Welcome to this video on craniopharyngioma clinical features. We'll explore how this benign but locally aggressive brain tumor affects vision, hormones, and cognitive function. By the end of this session, you should be able to describe the common clinical features of craniopharyngioma. You'll also understand the anatomical reasons behind these symptoms, including why the tumor affects the pituitary gland, hypothalamus, and optic pathways. We'll look at the main symptom groups and explain how children and adults may present differently. Early diagnosis matters. Detecting these tumors before permanent damage occurs can prevent lasting visual and hormonal complications. Let's dive in and break down what you need to know about craniopharyngioma, step by step. Craniopharyngioma is a rare tumor that grows near the pituitary gland. It comes from leftover tissue from Rathke's pouch or the craniopharyngeal duct. Although it is technically benign, it can grow aggressively in its local area. Children and adults can develop it, though the effects can differ depending on age. As the tumor grows, it often presses on nearby brain structures. This can slowly cause problems with hormones or brain function. Headaches, vision changes, and changes in growth may appear over time. Symptoms usually develop gradually. Patients may not notice them at first, but over months or years, the impact becomes clear, sometimes affecting daily life significantly. The symptoms of craniopharyngioma come from the way it presses on important brain structures. The pituitary gland is one of the first affected. When it is compressed, the body's hormone balance can shift, which may show up as slow growth, fatigue, or changes in development. Next to the pituitary lies the hypothalamus. Tumor pressure here can change appetite, mood, and the way the body uses energy. Patients may gain weight unexpectedly or have trouble controlling basic drives, even when they try to eat normally. The optic chiasm sits just above the pituitary. When a tumor pushes against it, vision can suffer. People often notice gaps in their field of vision, like missing areas to the side or blurred spots that make reading and daily tasks harder. Finally, the third ventricle can be involved. If fluid pathways are blocked, pressure inside the brain rises. This may cause headaches and, in severe cases, lead to hydrocephalus that needs urgent attention. A single tumor can affect all these areas at once. The result is a mix of hormone changes, visual problems, and neurological issues, making diagnosis and treatment more complex. Visual problems are one of the first things patients notice. They happen because the tumor presses on the optic pathways, which carry information from the eyes to the brain. The optic nerves lead from the eyes to the chiasm, where some fibers cross. Pressure here can blur vision or create gaps in the visual field. Behind the chiasm, the optic tracts carry signals deeper into the brain. Tumor growth in this area can cause a slow, progressive loss of sight. Visual loss happens in different ways. The tumor may push directly on the chiasm. Sometimes it grows behind the chiasm and affects the optic tracts. Pressure can also come from arteries above and around the chiasm, like the anterior cerebral and communicating arteries. These vessels may squeeze the optic fibers or reduce blood flow, which can damage the nerves and make vision worse. Patients may notice blind spots or a narrowing of their field of vision. In some cases, acuity decreases so much that reading or daily activities become difficult. Early detection and decompression surgery can sometimes restore vision, but permanent damage may remain if the fibers are badly injured. The most frequent visual problem seen in these patients is asymmetric bitemporal hemianopia. This means that the outer or peripheral parts of both eyes' vision are lost, usually unevenly. Sometimes the damage occurs behind the chiasm, causing a homonymous hemianopia, where the same side of vision is lost in both eyes. Other patients may notice blind spots in the center of their vision, called central scotomas, or a gradual narrowing that closes in from the edges, known as paracentral constriction. Visual recovery is possible in some cases. If the loss comes from pressure on the nerves or from reduced blood flow, surgery can relieve the compression and restore vision. But permanent damage to the optic fibers means some vision may never return. Early recognition and treatment improve the chances of saving sight. Endocrine problems are the most common signs in patients with this tumor. The tumor pushes on the pituitary gland or its connecting stalk, which interrupts the normal communication between the hypothalamus and pituitary. This disruption leads to multiple hormone shortages. In children, one of the earliest signs is poor growth, often linked to low growth hormone. Puberty may be delayed because the hormones that trigger sexual development are reduced. Some children develop diabetes insipidus, which causes frequent urination and intense thirst. Hypothalamic obesity can also appear because the tumor affects appetite control. Growth failure is usually the first clue that something is wrong. Adults face different problems. Many men report low libido or impotence, while women may stop menstruating. Growth hormone deficiency is common, affecting most adults with this condition. These hormonal issues often have a big impact on day-to-day life and overall well-being. Some patients develop high levels of prolactin, a condition called hyperprolactinemia. This happens when the tumor presses on the pituitary stalk, which reduces the normal dopamine signals that keep prolactin in check. More than 40% of patients show this problem. Diabetes insipidus can also appear even before surgery in about 8 to 35% of patients. It causes constant thirst and frequent urination. The body struggles to hold on to water, and symptoms can appear suddenly or gradually. Raised intracranial pressure can develop as the tumor grows. This is seen more often in children. The problem begins when the mass blocks the normal flow of cerebral spinal fluid, which normally moves through the brain and spinal spaces to maintain stable pressure. When this fluid pathway becomes blocked, pressure inside the skull slowly builds. Headaches often appear first, and vomiting may follow, especially in the morning. The optic disc may swell as well, a condition known as papilledema, which reflects the rising pressure inside the cranial cavity as the fluid continues to accumulate. These signs matter. They often signal increasing intracranial pressure and should prompt urgent evaluation. Hydrocephalus can develop as a craniopharyngioma grows and interferes with the normal flow of cerebrospinal fluid. The blockage usually happens near the third ventricle, where fluid pathways are narrow and easily compressed by an expanding mass. One common growth pattern explains this. Many tumors extend both inside the third ventricle and downward into the suprasellar space, a configuration often called intraventricular extraventricular craniopharyngioma. This arrangement is thought to occur when the floor of the third ventricle becomes stretched and thin, allowing part of the tumor to push upward into the ventricular cavity while the rest remains below. Intraventricular involvement is fairly frequent. It appears in roughly 73% of children and about half of adult patients. Complete blockage of CSF flow is less common with tumors that remain mainly outside the ventricle. Even large extraventricular masses often compress nearby structures without fully sealing the fluid pathways. Cognitive and behavioral changes are more often seen in adults after brain injury. Memory problems are common, affecting more than half of patients over 40. These problems are not random. They happen because key brain pathways that handle memory are damaged. Structures like the mammillary bodies, fornix, mammillothalamic tract, and hippocampus are central for storing and recalling memories. When these areas are hurt, a person can struggle to remember daily events, faces, or recent conversations, and their emotional responses may shift unexpectedly. Personality changes often follow. Damage in these memory circuits makes processing new information harder and can make emotions less stable. Patients may seem different to those around them. Memory gaps and emotional shifts can appear gradually or suddenly, depending on the injury. Understanding these effects helps caregivers and clinicians anticipate challenges. The brain is complex, but when these specific pathways are harmed, the patterns of memory loss and behavior change are surprisingly consistent. Awareness of these changes is the first step toward better support. In conclusion, craniopharyngiomas are benign tumors, but they can be locally aggressive. They grow slowly, so symptoms often appear late. Visual loss happens because the tumor presses on the optic pathways. This can cause gaps in the visual field and reduced vision. Hormonal problems result from pressure on the pituitary gland or hypothalamus. Children often show growth failure and raised intracranial pressure, while adults may experience memory difficulties and changes in personality. Early diagnosis is crucial. Finding the tumor before permanent damage occurs can protect vision, hormone balance, and cognitive function. Join the StudyNeuro community for high-yield neuroscience education and clinical pearls. You can find us on YouTube at StudyNeuro, on Facebook at StudyNeuro, on TikTok at StudyNeuroOfficial, on Instagram at StudyNeuroOfficial, and on X at StudyNeuro2025. Like, comment, share, and subscribe. Thanks for watching, and stay tuned for more.